Now, the death of Amos Isoka following a botched tooth extraction in Kawangware raises a difficult question. Who failed him? Amos did not just die from a dental procedure gone wrong. He died because a system neglected its duty. Tonight, the Kenya Dental Association is pointing fingers at the Kenya Medical Practitioners and Dentists Council, KMPDC, the very body tasked with monitoring and acting against unlicensed practitioners. Yet in this case, it did nothing. As Ode Francis reports, no government health or security agency has made a comment on Isoka's death, nor confirmed whether the suspect has been arrested.
Amos Isoka's death, caused by a quack doctor, has sparked serious questions about accountability. This was not just a medical mistake. It exposed weaknesses in a system meant to protect patients. The Kenya Medical Practitioners and Dentists Council, KMPDC, is the national body responsible for licensing and inspecting health facilities. Every year, it reminds registered practitioners to renew their licenses, yet enforcement remains inconsistent. The fees are clear: 15,000 for level 1 to 3 facilities, 10,000 for general doctors, and 15,000 for specialists. But what happens when a facility never had a license to begin with? KMPDC is meant to be more than a licensing body. It is a watchdog, and when watchdogs sleep, people die.
We have quacks who never went to school, who operate out there. We have assistants who work with us and who want to operate as doctors. In Kenya, we have about 2,000 dentists for 55 million Kenyans. Dentists are employed in public sector and private sector. But unfortunately, services access is very limited. Most of the public hospitals in most county governments do not have enough dentists. They probably have 1 or 2 dentists. And that makes dental services very highly in demand.
Despite its mandate, KMPDC failed to detect or shut down Life Clinic, an unlicensed facility operating in Kawangware for 3 years until Amos Isoka's tragic death brought it to light.
In the last year, we've had about 26 complaints of persons who reach out to Kenya Dental Association, reporting complaints that we forward to the Kenya Medical Practitioners and Dentists Council, because it is a body that is supposed to go and investigate. But so far, we are yet to get any reports from the KMPDC regarding dental malpractice issues.
In Nairobi, we have over 3,000 health facilities, but due to resource constraints, we only have 3 inspectors. Instances come abruptly, we are able to address them at that particular point. That is what you may call what you are calling knee-jerk, but it's actually not knee-jerk. It's responding to an immediate need.
The Kenya Dental Association, KDA, has condemned the incident, calling for urgent reforms. In a public statement, they demand stricter regulations, frequent inspections, and public awareness to prevent such tragedies.
That whenever you have a dental issue, however minor, you don't have to wait until it worsens out. And if it does happen so, you're having such a dental situation, go see a qualified dental practitioner.
Once you enter a clinic, the first thing you should look for is the clinic registration certificate, or at a minimum, their current operating license. Even the law says it should be prominently displayed.
On New Year's Day 2026, Amos Isoka walked into Life Clinic with a toothache. The man who treated him was not a licensed dentist. Within 24 hours, Amos developed severe swelling in his neck and chest. He was rushed to Kenyatta National Hospital, where he underwent 2 emergency surgeries, but he lost the battle before the 3rd surgery. The man responsible for Amos Isoka's death may still be walking free. Security agencies have remained mum on whether the unlicensed practitioner has even been arrested. As family prepares to lay him to rest, it will not be lost to Kenyans that Amos Isoka's death was not an accident. It was the result of a system that failed to protect him. Ode Francis, Citizen TV, Nairobi.